Just over a year ago, Laura O'Byrne enjoyed hiking with her two mastiffs, having fulfilled her dream of retiring by the ocean in Nova Scotia. But now she spends most days lying down with excruciating pelvic pain in her home in Shelburne County. O'Byrne has countless fibroids, which are growths around her uterus, and a large ovarian cyst, leaving her with urinary incontinence. The 58-year-old waited 8 months to see a gynecologist in Yarmouth. She says the doctor dismissed her concerns and told her fibroids don't cause pain. O'Byrne says the doctor refused to refer her for a procedure known to shrink the fibroids. She didn't feel it was an appropriate procedure for a woman of her age. She told her to find another gynecologist. So O'Byrne chose to act.
I just couldn't believe that I was stuck in this loop where I was still getting no care. And at this point, I had no quality of life. I can't tie my own shoes. I'm lying down and crying most of the time. A year ago, actually 14 months ago, I was fine. I'm not okay now. But I've worked in healthcare for decades in multiple other provinces. And I can say that the level of negligence in Nova Scotia is horrific. After that, I was so desperate, I contacted my former gynecologist from another province, and she deemed my case an emergency.
O'Byrne's doctor in Manitoba, where she's originally from, tried to refer her for the procedure that would shrink her fibroids. But it was denied because she needed to be referred by a Nova Scotia specialist. Her symptoms worsened, and the Manitoba gynecologist eventually determined she would now need a hysterectomy. She sent an urgent referral to MSI for an emergency hysterectomy in Manitoba, but it was denied because the procedure is offered in Nova Scotia.
I cried, I was angry. We have universal health care in Canada, so it makes no sense to me why, if a procedure, an urgent procedure, is available in another province and Nova Scotia won't offer it or is unable to offer it, why they wouldn't pay. I hope it's not cancer, but it could be. And if I wait in Nova Scotia, this is not where I want to die. I love this province. This is not how I want to go out. And it's completely unacceptable. This is straight up negligence. This leaves me stuck in this loop and frustrated and having to advocate for myself. And doing this interview isn't just for me, it's for other people who don't understand how bad healthcare is. And with the apathy in this system, there is no empathy. They can't coexist. And for people who are saying, oh, this is a shortage of doctors or a shortage of nurses. That is not the whole story. The quality of care is apathetic and it's dangerous.
Nova Scotia's health department declined our request for an interview. But in a statement, it said out-of-province care must start with a referral from a Nova Scotia specialist. But it also said it is reviewing the processes for evaluating claims for out-of-province travel for medical services. O'Byrne has appealed MSI's decision, but she says she's not holding her breath. Thomson, CBC News, Halifax.